Well, welcome, and thank you for joining us for another edition of the Leadership Café, where we talk to extraordinary people who are leading remarkable businesses. We're your hosts. I'm Michael Couch.
And I'm Richard Citron. And before we get too far along, we want to thank our sponsor, Vaco, a global talent solutions company. We really appreciate their support of the Leadership Café. Well, today we're very excited to have Art Hoops joining us. Art is president and CEO of Amari Medical Network here in Western Pennsylvania. Art, thank you for joining us this morning and welcome to the Leadership Café.
I'm excited to join you two this morning on the Leadership Café. I look forward to having a wonderful discussion this morning.
Yeah, well, great. Thank you. Well, listen, we always like to begin by asking you to tell us a bit about yourself, a little bit of your leadership journey, and of course, share with us a little bit about Amari Medical Network and what are you guys up to?
I'd be delighted. So I've been working for 35 years now. I originally started out as a certified public accountant back at Price Waterhouse in 1985. So that tells you that I've been around many years. And from there, I moved on into, I pursued my master's degree at the University of Pittsburgh, and I have an MBA. And then I went into manufacturing and operational management and strategic planning for a while. I had moved my career to a company called Berry Waymiller, which is in, they had a facility in Ohio. So we moved to Ohio for about 6 or 7 years. I ran a packaging manufacturing plant. We actually made fillers and which would actually fill liquids for different beverages, anything from Pepsi Cola to Sprite, anything from that perspective. And then
somebody has to do that, right? You wonder about who makes those things. Somebody has to make them.
Somebody has to do that, yeah. I mean, I think the most amazing thing was we used to make the packaging equipment for the little Kellogg's cereal boxes. You know what I mean? Yeah, so those were amazing machines that they could pack all that cereal in there so quick. And then when I moved back to the area, I ended up taking a merger and acquisition leadership position with Kennametal out of Latrobe, Pennsylvania. And then I spent a good bit of my career doing mergers and acquisitions. Then in 2005, I ventured out on my own to become a merger and acquisition consultant, and there was a company called World Health that had suffered some significant financial interruption as a result of some, questionable management tactics from the leadership. As a result, I was called in to do a reorganization and help with the reorganization, and then at the end of that, we ended up purchasing the Pittsburgh arm, which they had divested. So it was being in the right place at the right time back in 2005, made that acquisition. The company at that point primarily serviced the Pittsburgh area, and we provided medical supplemental staffing. So in essence, what we do is we help organizations fill in gaps, either for individuals or on leaves of absences. If they have an increase in census and they have a shortage of staff, we help them with that. We focus primarily on the skilled nursing and hospital markets, as well as recently we have started to dip into helping school districts with nursing as well.
But isn't that what an amazing career? I mean, that's what we've seen over and over with the remarkable leaders that we're talking to here in the cafe. The career is not a straight line, is it? I mean, you find these challenging opportunities that you go and learn something new, and move on to something else. So it sounds very, very, very intriguing.
Yeah, I mean, it was interesting because I came in as a consultant, and at the end, there was a situation where they were going to shut down the Pittsburgh piece. A company out of Atlanta had purchased the larger company out of bankruptcy, and then within 30 days, I made a decision to buy the company, arrange financing, and did the transaction all in 30 days. So, I wasn't sure if that was going to be the end of my marriage, but it turned out to be.
Well, it's amazing though. I mean, you made a really I don't know if it's 180 or a 360 degree shift away from what you were doing as a consultant in merger acquisitions to get into a medical staffing company. I mean, did you know anything about medical staffing, or were you just going to wing it?
Other than the 8 months that I had spent,
Sure.
Doing the consulting, I had spent 25 years in manufacturing, so it was a 180. The good news, that what made my decision easier, though, fortunately for me, was I spent 8 months understanding the business. A lot of people, when they do an acquisition, they come in, do due diligence for 30 to 45 days and have to make a decision. And I was on the inside looking out for 8 months, so I knew. Even though the organization financially was struggling, the operational piece of the organization was very sound and very profitable. So it was an opportunity to make that decision. But that started a lot of challenges as well. So we started out in the first 8 quarters, we grew 40% quarter on quarter.
Wow.
I mean,
wow.
Yeah, it was crazy. Then we hit and really, quite frankly, what was interesting, we never thought that there would be an issue where people wouldn't need help in the medical field. And we ended up getting into a situation where the recession hit in 2008, 2009. And we found that because we provide supplemental staff, we're the that last 10% that they need. So as people started to scale back in getting services as a result of the recession, we ended up having a tough time in 2009, 2010. 2011, we had come out as an organization doing about $3.4 million in sales. And from 2011 to 2013, we continued to do supplemental staffing. And it's interesting how you get into different things. I had one of my clients in the staffing business call, and there was an individual, a very prominent individual, who wanted to have around-the-clock nursing care in their facility, and decided to engage us privately. And ironically, 3 months later, they decided to go home, and they called us up and said, we decided to go, we've helped this individual recover, and now he's going home, and he would like to take the nurses with him and provide home health care. And then, so from there, we created a whole home health care division called Harmony Home Health Care to go with our Capital Healthcare staffing, supplemental staffing business. And that's really how that all started. It was just, we took that opportunity and ran with it, became a licensed, certified, medical licensed home healthcare company, and then from there we grew. And we grew. What was nice is that one of the biggest challenges in home health is having staff. So we were good at staffing, so we grew quickly in the home healthcare environment as well.
So one of the things I'm struck by, that's been a theme you've been describing so far, Art, is I don't know if it's fair to call this, but it seems that a label for you could be that you're an opportunistic leader. That you see opportunities coming up in front of you, and you're kind of quick to respond. That kind of suggests a bit of agility, and certainly you were a mergers and acquisition. You were a strategic thinker. Would you describe yourself as opportunistic in that regard?
Absolutely. I had 2 situations where they were right in front of me. And sometimes what's interesting is I always have the adage is I don't want to look back and said I coulda, woulda, shoulda, and and so I these opportunities were sitting there, and I had decided to jump on them. It was quick decisions. We went through it. We looked at the cost benefit of doing it, but it was worthwhile. We took some risk, and I don't think success comes without risk. And so we took those risks. They paid off for us tremendously. What was interesting, though, is that, initially we started out back in 2006. We're going to be coming up on our 15th anniversary in May, actually. So but we only had about 62 people inside the organization. And what has really been a unique transformation is going from an entrepreneur to start to get into the growth stage of the organization, and the different type of leadership skills you need as you start to build a team underneath you, and then you start to work through it, and and really become, in essence, it's really interesting because once you're an entrepreneur, and you buy a company, by default, you become the CEO almost. And so,
right.
right. Yeah. So it's like, you're still doing a lot of different things. So I always say I'm the CEO that does jack of all trades, right? But the point is, at some point, you have to start to look at it differently. And that's really what happened to our organization. So we had taken on the home care company in 2013, and we were growing tremendously. So we grew from 3.4 million in 2011 to $19 million by the end of 2017.
Wow.
And the entrepreneur in me said, that's great, we're growing like mad. The lack of the CEO never decided to put any infrastructure in. So we ended up at the end of 2017, we had 440 employees. We really didn't have a human resource department. We obviously paid payroll, but we didn't really have anything that did human performance management or anything from that perspective, and we never dealt with that. So in 2017, I made a decision that to actually shrink the company. So which is really a unique decision. But in 2017, I shrunk the company by almost $5 million, which was 25% of our revenue at the time. And it's one of those things where you start to go, a lot of companies fell at that growth stage because they don't really build the appropriate infrastructure in order to go to the next step. And that was really the decision that we needed to make back in 2017. And it's always difficult to be an entrepreneur and a leader and say, we're going to shrink the business by 25%.
Well, it's, what I've liked and appreciated about our work together is you have these the phrases like like you just said, that I don't want to be in the position of coulda, shoulda, woulda, and we see leaders that have these, they create these rules over time because they're learners. They pick up an idea, they recognize it's important, and we also in our work together, so you read a lot too, don't you?
Yeah, absolutely. We actually, I think one of the things that was interesting is that we started following a process of scaling up the organization. And when we started doing that, we've been going to some conferences, and I'll tell you what's really interesting is that, after I got my MBA, I'd read so many books that I was I'd never read another book. And I'll be honest with you, what's interesting is I spent, and it's sad when you look back, but I spent 15 or 20 years not really diving in and reading and becoming as knowledgeable. And what I've learned is that over the last 5 to 7 years is you must be a lifelong learner, right? And the environment changes, the world changes around you. And I think those are some of the mistakes that I made in not continuing to keep me educated. And so what happened is that we actually started in our organization what we call the Better Book Club. And so so we have over 300 or 400 books now that I actually pay. The books all have value on them, and I actually pay each one of the employees in the organization $400 a year to actually read.
So great idea. Great idea.
Yeah. And what it does too is that as they read through these books, the communication gap changes, right? Because when you're talking about these concepts, now they get to read about them firsthand, and then so when you're having these conversations, it closes that education gap much easier. And we've been very successful in everybody's really taken advantage of that. They've been reading books, and they've been more engaged in the organization as a result of that and having that knowledge.
Fantastic.
So 2020 was, of course, an amazingly challenging year. We're still kind of dealing with it, of course, with the pandemic and being in healthcare. What was this past year like for you, and how did you and your leadership team navigate through this year? I imagine you had some special challenges because you were healthcare, and we heard about shortages of nurses and other healthcare professionals. How'd that play out for your team, and how'd the team respond to that?
Well, we really had a roller coaster ride. So last March, what transpired was when it really first hit, uncertainty became a real issue for our business. So where when you saw the national media and everybody said there's, all these needs for nurses and everything from that perspective, nurses, like anything, have a tremendous amount of different stratification of disciplines. So, so there's a situation where, they needed ER nurses and ICU nurses and CCU nurses, but at the same time, the state of Pennsylvania and other states had shut down to protect people elective surgeries. So we actually took a dip in business in some respects, because our nurses, if they were operating room nurses, they actually didn't have work because they had shut down all the elective surgeries. And then in our home care division, we had a twofold situation. We had a situation where, because people were working from home more, they became family caregivers as opposed to us providing care in the home. And coupled with the fact that they were concerned of having the COVID be brought into their homes, they really started to decline and refuse care. Then what happened was so like in March and April, we were sitting in a lot of uncertainty on how to proceed and what was going to happen and everything like that. Then what happened on the flip side, by June or July, we started to see people willing to open up their homes, because we saw caregiver burnout from family members, because they were, and you've seen us all on television, right? You're trying to be on a Zoom meeting and there's a child in the background screaming, but us, on top of that, some of these people were caring for their elderly parents or caring for chronically ill children or adults. And so that burnout started to kick in June and July. So we went backwards and saw a rise in demand for our services in the home care environment. And then in the facilities that we serviced, they were struggling with the fact that their individuals were being quarantined and having COVID. So all of a sudden they had shortages. And so the demand for our people went up tremendously. And so our care providers, and I said this yesterday in a meeting, I said our care providers were heroes. Absolutely. They stepped up. They put on the shields, they put on the gowns, they went into these facilities knowing they were going into they were already identified as COVID environments. So, they were already going into situations where COVID existed, and they continued to be great. I had one nurse who actually worked in a home care environment that actually had contracted COVID from the client she was taking care of. And, God bless her. She said, I already have COVID. I might as well just continue to care for him. We'll just go through this misery together, so,
boy.
Yeah. So we really saw, when people talked about, having all these heroes out there working, I mean, we really saw it firsthand. So that was really a blessing, and it's great. I mean, our purpose is to care for the people we work with and work for. And, we had some great challenges. And I'll tell you a little quick story real quick. Is last year, the funny part is we started ramping back up. We couldn't get hand sanitizer for our home care for people to clean. So I actually, there was a distillery in Fayette County that actually switched from making moonshine to making hand sanitizer. So needless to say, our nurses were carrying in clear mason jars into homes, and, we had to explain to the clients that it was actually hand sanitizer, not moonshine. So, but we still have mason jars around the office here as well. So that was the laugh of last year. But I went down and loaded up the back of my SUV with cases of hand sanitizer that was made from the moonshine factory.
So you were a rum runner through the Laurel Highlands there. Like
yeah, exactly. Yeah, and that's what it was. It was really interesting to see, and the nurses really appreciated it. We went above and beyond. But then we always said the PPE, the protective equipment, that became a shortage, and then getting that was crazy. I mean, we would have our suppliers, give us ship dates, and 2 days before the ship date was to occur, they'd push it out another 2 or 3 weeks. and so it was really a challenge. So I mean, we had all our support staff in the offices. Every time they went to Walmart, they were picking up, you know, gowns or masks or everything they could. It was really a all out effort to be able to provide the protective equipment for our care providers in the field.
Yeah. Yeah, one thing, I think that's probably the theme that we've heard through the cafe when we asked the question about how people address the organization's ability to pivot and to innovate. We've just heard 100 fantastic stories. What do you think allowed Amari to do that? You know, what do you think in your DNA or in your culture allowed the organization to pivot so well?
I think what's really interesting is that, you know, one of our core values is to be passionate about caring, and you know, what really shined for us was that core value probably shined through greater than anything. We have another one, resourcefulness, right? So
Yep.
between these, the passion for people to make sure that people were cared for during this time, whether it be helping a care provider make sure that they don't get sick, or making sure that we care for those people in the home, or that we were there for our clients at the facilities to make sure that those people didn't go without care in those facilities. Was just amazing how that really came through, and that's a function of starting to hire to your core values, right? So, and you know, you hire to that core value, you have those type of people inside your organization, they go above and beyond to do that, even at their own risk. And so I think that was great. We just won a national award for quality based on the feedback from our clients during this period of time. And you know, they said that, you know, we were exceptional in providing that type of work. And really, you know, it was hats off to them, and they were passionate about doing the work and making sure that was done. I think the other thing is that I think in any given time, you see these situations create the human spirit, and it grows. It makes people think differently. I always said that, you know, I've been around a while. I always said that, you know, we never really started to optimize computer technology that was available, you know, late 80s, early 90s, until we had the recessions in the early 2000s.
Right.
And then what people had to do was they had to learn to automate, because they had to do more with less.
And innovate.
Right?
Yeah.
Right.
Automate and innovate. Wow. Yeah.
Yeah, and use the technology to be able to do that. So, and that's what you start to see, and I think that's what we did. I mean, we've invested in some technology that helped us become better. We were, you know, one of the things that we learned is that when we had to go home, so we just put a file share program in place on our intranet, because all ours was on a server in our offices, and when you were in the offices, it was easy to connect to, but you had to do a VPN dial-up from home, and so connections were going, and this was going.
Yep.
So we just went to a Microsoft file server now that is on the cloud, so now you can access those documents you need regardless, without any impact.
Yeah. Small changes, but significant. Well, Art Hoops, we want to thank you for joining us today on the Leadership Cafe. This has been a great discussion, and I know our listeners have picked up some great ideas about how they can strengthen their own leadership, including being opportunistic for one, and there are lots of others as well. Art, what's a good way for people to reach you and to find out more about Amari Medical Network?
Yeah, so you can reach Amari Medical Network at www.amarimedicalnetwork.com. And I can be reached personally at 412-229-1530, as well as Hoops, HOOPES, at chsstaff.com.
chsstaff.com. Great.
CHS. Great. And as a thank you for being a guest on the Leadership Cafe, we're going to send you an autographed copy of Strategy Driven Leadership. So we'd like to make sure you'll have 17 copies of these, I think, but we'll make sure.
I think so. But it's always worth adding another one to the library.
Adding to the library. Yeah. We also want to thank our sponsor, Vaco, for helping make the Leadership Cafe an important place for all of us to visit with some of our most successful CEO leaders in our community and beyond, like Art Hoops. Remember that you can listen to this webcast on Michael and my websites, as well as the Vaco website, www.vaco.com. You also see these posted on LinkedIn, Spotify, Pocket Casts, and your favorite podcast site that you go to. They'll be released every Thursday. And we want to thank our sponsor, our producer, director extraordinaire, Michelle Jarizowski, for providing such amazing support for us. For all of us on the Leadership Cafe, thanks for joining in. I'm Richard Citron.
Yeah, and I'm Michael Couch, and we look forward to connecting with you on the next Leadership Cafe.
Thanks, Art.
Thanks, Art.
Thank you.